There's an enormous theme, obviously, around how do we do things differently? How do we make healthcare and social care fit for the future? But also, how can we do that when we have got reduction in funding, we've got a lack of staff, whether that's legacy infrastructure, whether that's a tired, exhausted workforce that doesn't have enough. So what can we do about that? And that's technology.
It means that we're going to reduce clinical errors in the process, so that actually we're not going to have an issue with lack of sterile trays. We're not going to have an issue with the staffing and resource required to carry out procedure on that day. We're not going to have an issue with the blood or the donor materials that get brought in for that patient, because we've tracked everything back from where its origins were, how it's been transported, how it's stored, where it is now, when it needs to be, where it needs to be, with who, to be given to patient X. And that's how we bring it all together.
At the moment, we've got too much to do around the foundations and the optimising, and I think that's where CDW and Zebra come in, is around that real optimisation, but also building on that to understand how they can really impact on that transformational piece, but also build on their foundations of the technology that they've already got. To give quality patient time back on a one-on-one basis, which is absolutely the best way to be. And then fundamentally, all them brought together obviously bring efficiencies and financial efficiencies, reducing the waste within the system and the waste within those pathways of care. So partnerships are key to how we can support the NHS in supporting population health for the future. But also what's really important, what I really love about Zebra, is their thirst and want to really work in partnership, not only with us, but also with the customers. They want to do the right thing. They want to get the future of healthcare right. And that is evident in every single aspect when I deal with them on a day-to-day basis.